My name's Dr Stacey Wirth and I'm a general practitioner in Queensland. I have been a GP for nearly 25 years and I was inspired to be involved because I'm passionate about people making choices, knowing how much things are going to cost and not being surprised. Before I refer a patient to a specialist, there's usually been a couple of consultations and possibly some investigations, and then a decision is made that they need treatment outside of what I can provide. Essentially, it falls into two camps: private or public, and public is usually to your state's health service. At the point of referral, my patients generally want to know who I'm going to recommend to them, where they're located, and how much I think it might cost. So informed financial consent for patients is a very important part of medical practice. People don't want to be shocked by not being able to afford to pay the specialist when they go to see them, and that's why transparency is very important. So the practice I work at, we list our fees for the most commonly used Medicare item numbers on our website, and then at the end of each consultation I share with the patient what cost they'll have to pay at the front desk and then what their Medicare rebate will be. I encourage my patients to phone the rooms of the specialist, not only to make the appointment but to ask how much it's going to cost to see the specialist and then what their out-of-pocket costs might be. I do explain to patients though that sometimes the reception team don't know exactly how much the appointment's going to cost because the specialist might be doing a procedure that they don't know about, so they do need to understand that they can get an idea of cost but maybe not the exact cost for their visit. So if a patient has made some inquiries and realises that really they can't afford the out-of-pocket costs for the specialist treatment after their Medicare rebates, they will come back to me, and that's when we convert their referral. The Medical Cost Finder is an online tool that enables patients to search costs for specialist consultations and procedures, and I think that it's an opportunity for patients to get an understanding of what things might actually cost in their local area. The more information that we can put on the Medical Cost Finder, the more useful it will be to Australians.